Even before the dawn of COVID, the winter months of the year were always filled with stuffy noses and scratchy throats. But now that COVID's here, those symptoms might not always mean you have the common cold. Our Nixon Norman tells you what to look out for when you have to ask yourself, is this a cold or COVID-19?
Let's say you or your child is showing signs of being sick. The symptoms of the common cold, RSV, and COVID are very similar. So much so that when you do start to feel that scratch in your throat, you may not be sure about what you've got.
So I think initially you can't tell the difference. Symptoms can be mild to extreme, and depending on the age of the child, but initially it may all present very, very similarly.
Luckily for adults and older children, RSV is not a major area of concern. Actually, according to the CDC, RSV is a common respiratory virus that usually causes mild cold-like symptoms. Most people recover in a week or two, but RSV can be serious, especially for infants and older adults.
Typically, we think of RSV as being more severe in the much younger, newborns, infants.
One way to prevent you or your loved ones from getting ill is vaccination.
Getting your routine vaccines, getting the flu vaccine, and certainly getting the COVID vaccine for anybody that's eligible.
But because many people have put off receiving care, they have also put off getting vaccinated.
It's very common for patients to come in for their annual visit and to have not been seen in 2 years. With that comes delay in getting the seasonal flu vaccine, and then even approaching getting the COVID vaccine. So
this delay in care translates to a delay in overall immunity. So if you do want to get your child vaccinated but don't quite know how to bring it up, listen to what Di told her children.
Acknowledging that, this is a shot. It's a poke in your arm, and it's not going to feel good. But it's a brief poke, and maybe a little bit of arm soreness afterwards. But then you're getting so much immunity and protection to be able to hopefully get out of these masks one day and be able to get back to life.
Nixon Norman, Fox 54 News.